All right, welcome to Life Extension Live. I'm Dr. Mike, and that is
Dr. Crystal.
Thanks for joining us today. Today we are talking about migraine, not
migraines.
And that's an important distinction, isn't it, Dr. Crystal?
Yes, the National Migraine Foundation, really they're bringing awareness to migraine, and because many people downplay it, and it's a debilitating disease. I like the analogy. They say no one says you have is it an asthma's or put a plural, like you have asthma. You have migraine.
Right.
Meaning you have the disease. You are a person with the disease.
Yeah, and it's not just about head pain, headaches. It comes with a whole host of symptoms. So on today's show, what we wanted to do is talk about what causes a migraine, right? And what are some of the treatment options, focusing more on the food and the nutrition aspect of this today. Don't forget, we have our comments. Go ahead and, let us know what's going on. If you have migraine, let us know. And the things you go through, we'd love to hear from you. And we can see it right there, Dr. Crystal. That's perfect.
Yep.
All right, so let's get into migraine. What exactly are we dealing with here?
Yeah, so it's a disease with a complex variety of symptoms. Headache or head pain.
And there you go, right there. Migraine-related symptoms. You can see headache is a big one up there, but not. Some people actually don't have it. Matter of fact, we worked with somebody. Her name. Oh, should we say her name?
Probably not.
Okay. Well, anyways, we work with somebody who has migraine but doesn't have the headache part of it.
Right.
Has other symptoms.
The aura.
She has the aura. Yeah.
The light and visual disturbances. And she deals with that. And of course, we'll talk about triggers, but that's her main symptom. And she suffers from migraine and she monitors the different things that would bring on those different triggers.
Right. And again, I think one of the things I want to, and make sure I'm thinking about this correctly too, Dr. Crystal, is, here's what I was taught in medical school, right? Somebody has kind of this, what they call the prodrome state, where one of these symptoms starts to happen. And then it goes, if they have headache, it goes more into this aura phase first, then headache, and then it resolves. But what we're saying now is some of this stuff could be going on all the time.
Right.
It's not just that classic prodrome thing.
Absolutely. That's it, Dr. Mike. And so you may think, oh, I just have a sensitive stomach. Maybe I'm just nauseous. And depending on why, maybe you get nauseous as a woman when around your time for your cycle. That could be migraine.
Right. Yeah, you just never make that connection because we're so focused on the headache.
Right.
I would say, like, most people think of migraine probably as the aura and headache.
Right, but we found a stat that only about 20% of people 25% people have the aura phase of the migraine. But yes, you go through these different phases and they can start, up to a few hours to a few days, that kind of prodrome phase. Then you have that aura phase that can last for about 60 minutes. And then if you get the headache, that headache can last 4 to up to 72 hours. And then you have what they call the migraine hangover. And that's that last phase that can last up to 48 hours.
So Hannah, can you put that one graphic up with the phases? Not that one. Go to the next one, the phases. This is this is kind of the typical thing you're taught in medical school.
Okay.
So if everybody sees this to the right, see the prodrome? See all those symptoms? What we're taught is a symptom starts. If they have aura, it kicks in, then the headache, and then what you were just talking with, what's officially called postdrome, but a lot of people know as the migraine hangover happens. I think the point I want to make is that prodrome thing could be going on often in people. It's not, it doesn't have to follow this classic pattern, right?
But I think what's important to kind of know the pattern is, one, some people go through those phases in order, and two, some people, if you recognize those initial symptoms, you can kind of get ahead of that migraine attack, and maybe you won't go through the rest of those phases.
Right. That's a really good point. And I think we have, towards the end of the show, we got some good suggestions to maybe help out with that.
Yeah.
Right. So what I did want to mention something about the how long, if you do get the headache phase, isn't it over? There's if it lasts a certain time and continues, you definitely need to seek help, right? There's
over
a point.
72 hours.
Over 72 hours. Okay. So if you're having that headache for that long, yeah, it's probably time to go talk to your doctor, right? Because a lot of people, I think, when they go through this, they learn how to kind of manage this a lot themselves. Just keep that in mind if it's lasting too long. So let's get in. We got to be careful here, Dr. Crystal, because when we talk about causes, you and I love this stuff. We could easily go down a rabbit hole.
But we're not.
We're not. We're going to keep this simple, right? But I do think it's worth to talk a little bit about what may be going on here, because when we offer nutrition advice, some of that is countering some of those factors involved.
Yeah.
So let's start with what do we think is just like the underlying cause at this point?
It's a central nervous system disorder involving many areas of the brain. We do know there are triggers such as oxidative stress that's involved. We know that something's going on with the neurotransmitters, the serotonin. There's something going on with hormones, because we see it more prevalent in women. We also see more of the migraines occur related to the menstrual cycle. So we know there's the hormone potentially imbalance. But yes, and then we're also seeing something happening at the level of the neuron, where that neuron, the firing.
Like it's firing like at this rate where it spreads to the other neurons. It's called cortical spread depression, right? And this wave of electricity just kind of goes over that surface.
Yep.
So here's how I like to describe it. And I don't know. I mean, I think you like this analogy. It's the river. Do you like this one?
I don't know this
Yes,
analogy.
you do.
The river.
Upstream, downstream.
The river.
We talked about this all last week. A lot of the stuff we understand that's going on are all kind of what you might call like downstream stuff. The oxidative stress, hormones, serotonin, this spreading thing. We're still, science is still not sure though what's happening upstream.
Yeah.
Causing a lot of that to happen, right?
That is very true. And I think for our viewers and our listeners, I don't really know if they care.
Probably not so much. Again, this is where we don't want to get into the weeds.
Yeah, it's really those actionable things. We do know genetics play a big role into it as well. So if you have it, it's likely that you will pass on this disorder to your children. So just kind of be aware if they're, having sensory issues.
That's a good point.
And maybe they're sensitive to smells and things like that, because it is hereditary.
I will say a lot of the research now is moving away from the vascular system.
Yeah.
That was a big theory. Most of the research is now looking at that brain cell itself. There's something going on there, and then you add those other factors. So it's all kind of playing a role.
Yeah, and it's nerve activation and activation of pain receptors too.
Yeah.
So your body is more sensitive to pain, the sensation of pain.
Right. A lot of this has been focused on what's called the trigeminal nerve, right? And that's even one involved in the aura as well. Again, don't need to get into the woods of all this, but there's something going upstream with that brain cell. You're getting these factors downstream, and the end result is migraine. That's about the best we know at this point. I mean, we know a little bit more, but again, we don't want to get into the woods with it.
It's just not clearly understood.
Right. So let's talk a little bit then about triggers and risk factors, because here are the actionable items. right? This is now we're really getting into the part of the show where you got to get your notes out. Or I guess you could just rewatch the thing too. I don't know.
You can't just move it back.
Just move it back and rewatch it again. Let's start with triggers, because there was a nice large retrospective study involving 1,750 patients with migraine. And they were able to kind of list out all these triggers and how common those triggers were,
Yes.
right? So what did we find?
Yeah, the most common trigger, 80% of people, the emotional stress was a trigger.
I mean, I get it.
That shocked me. 65% hormones in females. We also see not eating, skipping meals.
So is that what that means?
Yes, skipping meals in 57% of people.
Okay.
Yeah.
So if you're somebody who has migraine, like if you're trying to lose weight, maybe intermittent fasting is not the right way for you to go.
Exactly.
Right. We have then weather changes. 53% are affected by weather. Sleep disturbances is 50%.
And let me just pause. With sleep disturbances, that's not enough sleep and too much sleep.
Too much sleep.
So you find that people that maybe they're not getting enough sleep during the week, and then they try to make up for it on the weekends and kind of sleep in and sleep longer.
Doesn't really help.
It
though.
triggers. Yeah, it can trigger a migraine attack.
I know. In my life, when I've tried that before to catch up, and you get a lot of sleep one night, I actually feel groggy that next day. You don't feel right awake. So that 7 to 9 hour frame is still where we always want to be. Odors. 44% of the people are very sensitive to what they smell.
Yeah. So you have to be careful. Know how to spray your perfumes or your colognes. The trick is to kind of spray in the air and then walk into that cloud. So then it's not so strong on your body.
I actually do that. Yeah, because guys back in the 80s, they would just take that.
Yes, and you don't need 5 or 6 sprays.
Oh, it was more than that they did.
No. But you have to be mindful and think about the people that you work with as well.
Yep.
And ask them, is this okay? I had a coworker that would spray on, light up the entire office. And someone had to speak with her and just say,
too much.
It's too much.
Yeah. Lights also, about 38% of people use lights have lights as triggers. I told you this, that we've had a friend of mine who really can't deal with those lights. What are those basic lights?
The fluorescent
lights. And so for her, when we have these meetings at our church, we use lights that are more calming.
Oh yeah,
we
incandescent lighting.
Yeah, we turn those off. Helps out tremendously for her.
Wow. Yeah.
Alcohol consumption 38%, smoking 36%.
Yep.
So right there's a bunch of stuff. So like when we say 80% emotional stress, what does that mean? Well, it means we need to manage stress.
That means if it's meditation, mindfulness, stretching, listening to calming music, these are things that to help you manage your stress. Get a good therapist.
Absolutely.
Cognitive behavioral therapy.
100%.
It works.
Talk to somebody.
It works. Treat yourself to it.
Now, we've done a lot of other shows too, like with hormones and females. We've done all kinds of shows on menopause, perimenopause. Go check those out because we cover a lot of good suggestions there of how to keep your hormones balanced, and maybe that can help. Yeah,
but what you sometimes find, especially when you're looking at the menstrual cycle, sometimes towards when it's like that 7-day period and you're getting the drop of the hormones, some integrative practitioners may recommend maybe adding in a little bit of hormone cream just to kind of help you to get through. So it's not that period.
So instead of just dropping like crazy, it's more of like a
yes.
And that may help. Maybe that controls the trigger. Right. So know your triggers. Right. Investigate. Work with your doctor.
Well, you have to keep a tracker. Well, that's what the doctors will say.
Let's get to that. Yeah. Because the next step is something called SEEDS. What is that?
Yes, that's what do you call it? A mnemonic?
A mnemonic, yes.
Did I say that correctly?
You got it.
SEEDS. So the S stands for sleep. E, oh good, it's on the screen. E for exercise. Another E for eat. Now, can we talk about eating? First, let's go back to exercise
I want to
really
talk
quick.
about all of these. Hold on.
Okay, so let's just go through the list and then we'll break it down. So we have S for sleep, E for exercise, E for eat, D for diary, and S for stress management.
Okay, so number one, sleep. This is where we need to focus on that 7 to 9. Make sure you understand what good sleep hygiene is. Preparing for sleep, which starts about 2 hours before you go to bed.
Yes.
Right? Lights coming down. I hate to say it. Phones away. TV should even be off. Right?
Yes.
Get a good book the old-fashioned way.
I know, with a little incandescent book light.
I mean, so there's a lot of things you can do there. Keep your place colder.
Yeah.
We sleep better when it's colder.
That's very true.
Right? So again, these are some suggestions for you. I also throw in melatonin. Love it. You don't have to. I'm just saying I like that. So just there's some suggestions. Now, what about exercise?
Yeah, exercise. I just read something today that stated that you have to be careful with vigorous exercise. For some people, it could be a trigger. So you kind of have to kind of figure out, exercise is important. So it's something that you should do, moderate exercise, and kind of gauge whether or not if you over exercise, it triggers your migraine.
Know that point.
Yeah.
Where you need to stop.
Yes.
And you may have to play with it. Maybe you don't know.
Exactly.
And one day you do push it a little bit too much and you learn from that.
Yes.
Right? So I kind of, I find this interesting that like the sleep, the exercise, it's all about finding that place that's perfect for you. Yes. Too much, too little is triggering something in that migraine stream, Dr. Crystal.
Very true. I like that, Dr. Mike. It's about not following the trends. It's following what's best for yourself, personalized health plans.
Now eating, what are we talking about?
There's so much to cover here. So we talked about don't skip your meals, number one. Manage the wine intake, specifically red wine, meats, like processed meats, cheeses, all of those can be problematic. They contain tyramine. Be consistent with caffeine. So I'm just kind of putting anything that you're kind of consuming in this category of eat.
Well, if you look at a lot of these things, caffeine can be stimulating. Tyramine, which is associated with headaches and activation of neurons. A lot of the nitrates. I think a lot of what I'm reading here, we need to watch those things in our foods that could bring up that sympathetic nervous system too much.
Now, but one thing with caffeine, yes, what you just said. Caffeine is a little unique because it's about being consistent with your intake. So caffeine may not trigger a migraine, but if you skip that morning coffee, that can trigger you to have an attack.
It goes to that balance thing. If you're used to caffeine, give your body that little bit of that caffeine.
Yeah.
Oh, that's really interesting stuff. So the red wine, that's an interesting thing for me too, because what people might hear then is, then I can drink beer as much as I want. I can drink. Don't do that. Alcohol is always in moderation, because even if you're not drinking red wine, remember, if you drink a little too much, you'll sleep initially great. But then when that alcohol starts to metabolize off, that activates your body. That could be a trigger.
There you have it.
So watch that as well.
And then again, the diary. Keep the diary. That's going to help you to identify those triggers. That's going to also help you to have kind of that rescue medication. So if you're finding, oh goodness, this is the prodrome phase, this is one of my symptoms, I need to take something now to prevent this from, turning into a week-long attack.
Yeah. Good point. You feel it coming on. Start dealing with those triggers. If you're taking something, write that down, because you got to know what's working.
Right.
at the end of the day. And as you said, physicians that focus on migraine, they all do this. They all believe in journaling, big time, right?
Yes.
And then stress management. I mean, yeah, goes hand in hand with sleep, right?
I know.
Yeah,
I know it's the hardest thing to do, but once you have to just kind of figure out your stressful triggers, more triggers.
We all have them.
What's causing you to be stressed out? And it could be coming from inside, Dr. Mike.
Yeah.
Your own brain and how you are perceiving the world around you.
Oh, that's a good
could
point.
be your stressor.
Yeah.
And that's where you kind of have to get into therapy and deal with past traumas.
For sure. I know for me in my life, I feel I need to unplug at times. You know what I mean? That's how I feel. I feel like today we're all like cell phones. Like we're plugged in and we're just information, pictures, trends, right?
Yes.
Just pull it out.
Unplugging without guilt.
Yeah, no, don't please. That's just going to add to the stress. Yeah, it's okay to unplug. It's okay to have that me time.
Yeah.
You know, medications. You know, if you got to go on drugs, if that's between you and your doctor.
Yeah.
That's fine. You know, we do whatever is working for you. But a lot of the drugs you're going to be on, they basically are constricting vessels. That goes back to that vascular idea. You wonder if that's going to maybe not be as prominent then, those kind of drugs? I'm not sure.
Well, and you do find, I think a lot of the first line are also working with that serotonin
that's right.
reuptake. And so you'll find that first. I think people are a little concerned by having to be on those types of medications. But, you know, again, if you are someone, I think of it like asthma, right? You have asthma, you have an asthma attack, and you do what you have to do to prevent yourself from having that attack. And if that means you have to take, you know, steroids, that's what you have to do. And so it's the same idea.
Right. There are newer medications too that help to kind of calm the nerves down, those pain signals. Again, you just have to talk to your doctor about all this. And NSAIDs can work, acetaminophen, and you can't. Here's the thing: if you talk to somebody else with migraine and they say, "Well, this is what I do and it works great," that's what they do.
Right.
You got to figure out what you need to do.
That's so true.
Yeah, and so if somebody says you should never do those drugs, this is what no. You do what you need to do.
That's right.
Hands down. We do want to talk now a little bit about the natural side of things, the foods, the nutrients, because I do think this can play a role in helping just to kind of bring down those triggers, you know, maybe decrease the frequency of going through those phases. That's where I think that the power of food and nutrients come.
Yes. And so I'll start, if you don't mind, with hot off the press. So Dana Dye, who's our internal researcher, she does a lot of the research for our shows, just sent us something yesterday on omega-3s, right? Omega-3 fatty acids and migraine. So I said, okay, check and check.
Easy.
Check your omega-3 status.
Yeah.
Your
I would definitely
index.
do that. Definitely do that with that blood test.
That's right. And then take omega-3s if you find out that you're low. That's number one.
Look at that. One of our favorite friends.
I know. I always love to see that.
Yeah, I do too. So we talked about one of the factors being oxidative stress, right? Lower oxidative stress in your body as much as you can. There is some research showing that N-acetylcysteine can work, and also lipoic acid can really help out.
Both of those help to support the universal antioxidant in the body, which is glutathione. And so those are two nutrients to consider.
What about if hormones are an important part for somebody that's listening? What should they be doing?
Yeah, checking your hormone. Do a hormone panel. Testing your hormones and see if there's a way to bring about some balance there.
Okay, so we want to now do what we're calling nutritional add-ins or add-ins. These are things that have some decent research behind them. Again, I'm going to be with migraine. The research is not complete yet. There's a lot that still needs to be done, both on the conventional medicine side and on the natural side.
Yes.
Would you agree? Yeah,
I totally agree. What's nice about the nutritional add-ins that we are bringing up, we're seeing sometimes we see there's a lag between the nutrients that we're seeing in more of the complementary alternative medicine field versus the nutrients that you see on the conventional medicine field.
Right.
And these nutrients, we're finding them in both places.
Yeah. So these are good, solid suggestions.
Yes.
Number one is vitamin B2. Riboflavin. How much a day should we be taking?
400 milligrams per day. You want to give it at least 3 months.
3 months to kick in, basically. Yeah. So that's almost like omegas. It's like a no-brainer.
Yep.
So it is cheap. It's a B vitamin.
It's exactly right.
It's
It's a B vitamin.
So simple.
Water soluble.
Next one that we liked was butterbird. Should we explain what that is?
Butterbird, yes. So it's a little shrub, and we're talking about the leaf. I mean, the root.
The root, yeah.
Of the butterbird. You find just a cool fun fact. If you want a fun fact, Dr. Mike always has the fun facts. But the name butterbird comes from back in the day. They used to store butter in the leaves of the butterbird shrub. So there you go. It's a weird name. So people want to know butter.
So the shrub, before it was called butterbird, apparently, the shrub was a container for butter.
Yes.
And they decided, well, let's call that butterbird. Hey, where's the butterbird container? That's great. I love that. 75 milligrams twice a day. You do want to make sure it's standardized to things called these pistacins. Those are just these key compounds in butterbird that are really doing the work here.
Yes.
After 4 months, there was a 48% reduction on average in the frequency of migraine.
Yeah, so again, tried and true with the butterbird. This has been validated by the American Academy of Neurology, the American Headache Society. They all suggest and recommend this for migraine. And
then what about CoQ10? That's another one we love so much.
Yes.
Like our good friends are here today.
I know. CoQ10, there's an idea of mitochondrial dysfunction. We also know that CoQ10, ubiquinol, is an antioxidant.
I think that's maybe a part of it. We forget it's actually a pretty powerful one.
Yes. And so there's a small randomized control trial, 42 patients, 100 milligrams 3 times daily of CoQ10. So that's a bit more
300 milligrams.
than what most people are taking. Most people take 100, maybe 200. Yeah. So we're talking 300. Those individuals experience a 50% reduction in attack frequency at 3 months versus the patient on the placebo. So CoQ10, another foundational nutrient.
Absolutely. Along with your fish oil. Yeah. You got your B vitamins in there.
I think the only unique one is the butterbird.
Is the butterbird, yeah. So again, we really like these ones because you're seeing these on both the natural and the conventional side pop up. Now, there is one last one. This is magnesium. And it's here's what, tell me if I'm off here. Most of what we understand about magnesium, it's not really, if you take it, does it really help? What we do know is that if you're low in magnesium, that seems to be a trigger for some people.
Well, I think potentially, I think the magnesium was initially brought into the picture with the whole vascular theory of migraine and kind of helping it to relax the blood vessels. But we also know it's very calming to your neurotransmitters as well. So, it's just one of those nutrients that people say it helps. We have some promising research that it may be beneficial. So why not?
I was just about to say,
why
it doesn't
not?
hurt to take a 500 milligram magnesium capsule every day. Just do it.
Yeah.
It's good for many other things anyways.
Exactly.
At the end of the day. So so that's a nice list. Watch those certain foods, your red wine, the caffeine. And again, it's not don't do the caffeine. Do what you normally do. Get your normal sleep. Mm-hmm. There seems to be something interesting about not doing what you normally do.
Yes.
That's interesting.
Yeah. I'm
thinking about this more and more and more. You know what? You have your pattern. Stick with your pattern.
Yeah.
Okay. I'll get off of that. And then, of course, those add-ins, those nutrient add-ins we covered. Listen, those are all, give them all. Just do it. Why not?
Yeah. I mean, if it's something, again, that is causing you to miss out on life.
Yeah.
Miss out on work and probably the anxiety. If I can't go to a concert because the lights are going to trigger my migraine.
That's common, I'm sure, right?
Right, right. It's anything that can kind of improve your quality of life.
Yeah. Here's what I would do. Start with one at a time. Yeah, right. Well, CoQ10 is a great one. The omega is a great one. Or maybe you're already doing those two. Add some magnesium, maybe. Try the butterbur, because when you do something one at a time, you have a better assessment of how that's affecting you, right? So one at a time, doesn't really matter which ones you want to start with. They're all good at the end of the day. Hey, mom's advice. We love looking at the questions people ask on Google.
I know. I heard. Is this true?
What is this true? Will a hot shower help migraine?
Some people say it does.
That's it? That's all you got?
So try it. I mean, we don't have any hardcore research science to say, yes, get in that shower is going to help, but maybe it's a self-care. Maybe you stay in that shower a little longer than you do. Maybe you do a nice body scrub in the shower, exfoliate.
I thought you were going to give me this whole explanation, and you're just like, maybe.
No. No, it's a personalized thing. Yeah. It's not something where it's guaranteed to work.
Right. But for some, apparently it does. And with migraine, your personal journey with all this and what works for you is what works for you.
Yes. And nothing's better than a good, nice, warm shower.
It is. I do like that.
Oh, it's the best.
You think about a nice, warm shower. We forget how lucky we are in this day and age.
That's true.
Warm showers have not been around that long. Flowing hot water through your pipes, Robson, has not been around that long. Enjoy it.
Yeah.
Enjoy that. All right. We have a really nice protocol that Life Extension has put together. Now, our protocols are extensive. I mean, this isn't seriously. You look at this protocol, dive into it. You're going to see much, much more of the science, the theories, the factors, the triggers, all that kind of stuff.
Yep.
It's fantastic. lifeextension.com/migraine. There it is on the screen. And when you're there at Life Extension, they want to say thank you for being an audience member of Life Extension Live. You can use the discount code LELIVE, and you'll get 10% off $50 or more, plus free shipping and handling.
That's right.
LE Live. Just use that discount code. Don't forget, we go live every Wednesday at 12 noon Eastern Time. Whatever channel you watch us on, because, we're not just on Facebook.
No.
We're on many.
Instagram.
YouTube. I never remember what we're on. But there's more than just Facebook. Wherever you're at, hit that interested button, subscribe button, follow button. That way you always know when we're going live. 12 noon Eastern Time. I'm Dr. Mike. That's
Dr. Crystal.
We'll see you next week.